Intravenous medication administration is one of the most common procedures performed by nurses. It requires careful attention, proper hygiene, and the correct technique. Safe medication administration is essential for patient safety. In this video, you will learn the basic steps of safe intravenous medication administration. The first step is to verify the medication order. Check the medication name, dosage, route, and scheduled time. Next, confirm the patient's identity using the appropriate IDEN. Wash your hands thoroughly before starting the procedure. Put on gloves if necessary. Make sure all required supplies are prepared in advance. These include the syringe, medication, cotton or gauze, antiseptic wipes, and a step. Prepare the medication carefully. Always follow the basic safety check. Inspect the intravenous access site. There should be no redness, swelling, pain, or fluid leakage. If everything appears normal, you may continue with the procedure. Before administering the medication, clean the injection port with an antiseptic wipe. Allow it to dry completely Administer the medication slowly and in a controlled manner. Injecting medication too quickly may cause unwanted side effects. Throughout the procedure, closely monitor the patient's condition. If the patient reports pain, dizziness, or discomfort, stop the procedure and assess the situation. After the medication has been administered, flush the intravenous line with the appropriate solution. This helps ensure the medication enters the bloodstream completely and keeps the IV line. Continue to observe the patient for several minutes after the procedure. If the patient develops difficulty breathing, a skin rash, dizziness, or any unexpected. Once the procedure is complete, dispose of all used materials safely in the appropriate medical waste containers. Wash your hands again. Record the medication. Safe intravenous medication administration depends on careful preparation, a clean working environment, and following each step correctly. Thank you for watching. If you would like to learn more nursing skills and clinical procedures, don't forget to subscribe to our channel for more educational videos.